Hi, I'm Chris Mashburn. I have over 30 years of experience in healthcare security and biotechnology. I've built and led organizations that focus on compliance, operation, and crisis management. My background ranges, oddly enough, from law enforcement to building businesses and also developing operational aspects that has given me a unique perspective in integrating technology to improve efficiency and decision making. Today I want to share a couple of things with you about how AI has transformed healthcare by enhancing organizational processes, but also improving decision making. Point one I'd like to make today is how AI improves operational efficiencies. One of the biggest challenges in healthcare is managing complex workflows. AI can automate administrative tasks like patient scheduling, claims processing, compliance monitoring, all those things that really take day-to-day operational aspects in healthcare and move it to an operational efficiency that can be focused on. This reduces human error, it cuts costs, and it allows healthcare professionals to focus on what truly matters, and that's dealing eye to eye with patients and dealing with patient care. I'm going to give you an example. AI-driven processes can automate and help hospitals streamline resources allocation, ensuring that staff and equipment are used effectively. So point two I'd like to make is AI enhancing clinical decision-making process. AI is revolutionizing how we analyze patient data and how data is actually analyzed and looked at going forward. With predictive analytics and machine learning, we can identify patterns in patient records, helping doctors truly diagnose conditions faster and more accurately. AI can also help support treatment decision making by suggesting personalized care based on real-time data. So this is data that is actually not only from the initial visit, which could have been months, weeks ago, to the real-time data that's happening as the physicians are actually dealing with the patients. So this not only improves outcomes, but it also reduces the burden of medical staff, leading to really a much better patient experience. Because as we know, the more time that physicians can spend face-to-face with a patient, actually hearing the conditions that they believe they have, makes that patient feel like they're actually being heard. It allows them to give more detailed information to a doctor, and that'll lead to a better outcome for a patient's patient experience. Point three I want to make is how AI strengthens healthcare security and compliance. I know it's a concern of patients today and really from the general public of what happens with my data when you introduce AI. Well, what really the real answer is today is it's more secure than it ever has been before. What we have found that utilizing AI can actually secure data, it can compartmentalize, and it makes the data more available to not only to the patient but to the physician in really a secure way. So AI-powered security systems can also detect anomalies in the network activity. So this would prevent breaches, which we all hear about today's day and time. We hear about them over and over again. With AI detecting anomalies, it can actually act as a barrier and a more secure fashion to actually help compartmentalize and hold that data secure. Additionally, the compliance automation tools help the finalized process of actually securing the data and reducing the risk of costly violations. You know, with AI in healthcare organizations, this securing this and safeguarding the data while maintaining efficiency is a win-win for both the patients and the physicians alike. So in conclusion, what I'd like to point out is AI is no longer the future state, it's the present state today. By integrating AI into healthcare operations, clinical decision making, and security in organizations can drive better outcome, can reduce cost, and really improve patients' care and the patient satisfaction when they actually go and see a physician. The key is to embrace these investments and strategically ensuring that technology supports rather than replaces the human expertise. And what I like to say is, and we hear this all the time, we hear the revenue cycle and the data clinical groups actually ask, well, is this replacing me? It's really not. It's what we call upskilling the human factor in today's daily operational aspects of the operations, the office operations, that helps improve really better outcomes. So with that, AI-driven solutions really is a key factor in helping healthcare today, and we'd love to talk to you more about it. So feel free to reach out to Jorie AI, and let's build a better and smarter and more efficient healthcare system.